Hello, beautiful people. This is Orjanette Cooper Bryant, board certified family nurse practitioner, author, and mentor. Well, today I want to share some medical information with you and facts. Okay, let's talk about AKI, which is acute kidney injury. We need to know when it is necessary for them to seek hospitalization, and what can you do on an outpatient basis. I bring this up because the number one thing that I see in the hospital setting is acute kidney injury. Now, I don't know if you know that dehydration and rhabdo, which is muscle wasting of the lactic acid buildup in your system, generally, let me explain that a little bit better. If a senior citizen or anyone falls and they're on the ground for 48 hours, they are at risk for rhabdo. And what happens is toxic levels of lactic acid spills into their muscles, and it can cause kidney injury or kidney damage. So there are 5 stages of kidney disease or kidney damage or injury, but we want to make sure that we are addressing the issue at a stage 1. Stage 1 is typically those people who you see who have volume loss or depletion of fluid. It could be from GI symptoms, diarrhea, nausea. It could be from blood loss. It could be from any kind of volume loss. And the objective would be to do fluid resuscitation or increase the fluid. At VitaLift Infusion, we do support IV infusions, and we do infuse vitamins. So it's very important that you understand that volume is necessary sometimes when it comes to preventing your kidneys from shutting down on you, or for you going into a second stage of kidney failure or disease. Certain diseases like diabetes, medications like the GLP-1, SGLT2, Jardiance can cause kidney problems. Oh, and don't forget your senior citizens. A lot of times they have kidney infection or urinary tract infection and develops kidney infection. We're all at risk of some kind of AKI. And it's important that you understand that you can prevent that from going into a full-blown stage 4 end-stage renal disease. But you have to first identify it. As a practitioner, as a provider, it is important for me to draw your CMP, comprehensive metabolic profile, to tell me what your bunny or creatinine is, because as your bunny or creatinine start to rise and your GFR starts to change or decrease, you become more susceptible to a staged kidney disease. African American people do have a lower GFR, glomerular filtration rate, and typically we'll see levels from a 90 to a 60. But you have to understand that at that stage, you need to keep coming into the doctor and let us see what's going on, or the nurse practitioner or the PA. You need to let us see what's going on with those labs and do comparison analysis. We also need to make sure that we're helping you, educate you about NSAIDs, Motrins, Aleve, medications that can cause renal problems. If you've been in the hospital and you had a CAT scan because you had a gastro bleed or some kind of gastrointestinal infection or issue, you definitely need to consider the fact that the contrast media may still be in your system, and it can cause some kidney problems. Even medications like the simple metformin, you have to make sure that you're really fully having these conversations with your providers. And I say this because a lot of people think that if I get blood work done once a year, I'm okay. Well, that's not necessarily true, because in medicine, we study the numbers and the science and the organs and how they respond to what we're doing in the treatment plans. That's why we always say get a baseline lab. So I don't want to bore you too much, but I want to help you understand that AKI is acute kidney injury, and it is preventable if you hydrate and you replace that volume that you've lost. So if you have any questions about AKI, please let me know. I am Orjanette Cooper Bryant, the owner of VitaLift Infusion, and my number is 386-336-4229. Love to see you and hear from you soon. Thank you.